Thank you. Today we have with us our guest as Dr. Hubert De Silva, M.Sc Psychology, B.H.M.S, Chief Physician, Homeopathy Clinic, Kalaputtam, Trivandrum, Kerala, India. With 35 years of experience, moderator IFPH, is a composer, musician, and singer, multi-talented personalities. Dr. Hubert Silva, and the topic is discussion on neurology. On behalf of IFPH, I am welcome Dr. Hubert De Silva. You can have the platform for the next 45 minutes. It's over to you. Please proceed.
Thank you, Dr. Manesh, for your kind words. So I can see all the faces. The great Bhishmacharya and Kaurava.
Dr. Hubert, thank
Can
you,
you?
thank you, Dr. Hubert, for taking this.
While Arjuna seeing in the Kurukshetra, he can see the opposite side. Bhishmacharya, Drishtabdimna, Dharma, Duryodhana, everybody, his relatives and those who, the great warriors, again, in front of him. So I'm also such feeling. So now let us start. I think that it is a great thing. Today at 6 o'clock, Dr. Danesh called me and said, Doctor, today's guest will not come because of her some technical problem. Her mother or somebody when was hospitalized, she has to go. That time he called me to say, can you take any subjects? Yeah, I told you that. I told him that I can take endocrinology, but now I got a case of neurology, so I changed, slight changes I can make. Today, I sent on case. Today, not yesterday. A few days back, she is my patient for last 1 year. So many cases, so many times she came to me, and I had treated, and she got relief. But 3 days back, she had severe headache. So I gave the medicines, and she told me that it is not coming down. So severe, the pain is severe. So I sent her to take a CT scan. Now I got it a few minutes back, half an hour back. The case is sub-centimeter hypodensity noted in lentiform nucleus on the left side. The impression is prominent via space, chronic lacunar infarct in lentiform nucleus on the left side. Chronic lacunar infarct in lentiform nucleus on the left side. So if I am keeping her without taking the CT, what will be the condition? We don't know what is the reason for that headache. There are so many small infarct clots in the brain, inside the brain, just near the line of mediate line of hemispheres. Many. The infarct may be 2 to 15 mm in size. That is normally what may be the reason? If we are treating, normally I give whenever I treat cases of neurology or brain, I used to give cactus, arnica, and belladonna for every case, each and every case. But here, now, there are so many clots in the brain. You know that what may be the reason? Her husband told me she is 41 years. her husband told me. Now I told them that it may be why he called asked me why it is so. What happened? The doctor who took the CT scan told him that immediately you go to a neurologist. And what will be the treatment? There are two types of treatment. They will give medicine to dissolve the clots. One, if it is not it is not giving any improvement, then normally it may go to neurosurgeon. In such cases, what we have to do, what we must do, what is the importance, how a homeopathic doctor do in such cases. That is what I did a few minutes back. The first thing I told her and her husband, he came after coming her, that I am just doing to dissolve the clots of the brain. That is what I first do. I am not going to do anything because other things, if the clots are dissolved, then the symptoms will be disappear. So we have to give, I gave her 3 medicines. One medicine, Calcarea carb onam. The other medicine, Arnica onam. Another, the tissue remedy I gave her, Calcarea floor 3x. This I give her for 1 week. If I, the 30, Calcarea 30 also, I had given Calcarea 30. Calcarea onam and 30. At the same time, I am using the 2 potencies. Why? That is my discernment. In such cases, we have to decide what to do. We cannot, we know that. I told her that it may be the reason of taking what? COVID vaccine. She took 3 COVID vaccines. That may be the reason. So, that time her husband told me that, yeah, after taking all this, I have also complaints. She is also having complaints, and my father, mother, everybody having complaints. There is chances, sudden death. We know that many people are nowadays fainting down and dying. Youngsters, one of my friends told me that 3 of his friends in Gulf were died between the age of 25 to 32. 3 of his friends. So we must be very much careful. And in such cases, we have to say them that this is a serious condition, but we cannot make them panic. Because if we make them panic, the cases will aggravate. It may do damage to them. So I just console her. We can manage. We can do. And I told them that what they will do if they go to a neurologist, then what they will do, I told her. So they prefer my treatment and they have faith in me. So I am going to treat the case I am treating now. I just come to this, what I want to say that I have to conclude this, that we should do, it is very much needed in cases we have to take CT. Otherwise, we are treating without any knowledge, just taking the, we could not understand the seriousness of the case. If now we are serious and the patient is also serious, and they got an advice from the allopathic doctor that they should immediately go to a neurosurgeon, neurologist. So what I want to say that there is a time for everything. Let me share my screen. There is a time for everything and a season for every activity under the heavens. There is a time for everything and a season for every activity under the heavens. Timely interference, watchful expectancy, and timely interference. I heard this when I was studying in my medicine clinic. One doctor told that when watchful expectancy and timely interference, while we are taking a case of a gynecological case or when we are going to take a delivery. So we must be very much watchful and take immediate. If it is immediate, we have to take a immediate action. It is written there is a time for everything and a season for every activity under the heavens. So our work should be done. Pituitary gland. When considering, I told Danish doctor that I'm going to take endocrinology, but I slightly changed neurology. So it is in the brain. We know that pituitary gland is in the brain. What I was astonished while seeing pituitary gland in our body, very small one. I was studying for 2 months about the anatomy and physiology of the pituitary gland in our second year medicine. After seeing the pituitary gland in the dissection hall, that time I was astonished. In this, all the hormones are controlled by the pituitary gland. So pituitary gland, a pea-sized endocrine gland at the base of your brain, behind the bridge of your nose and directly below the hypothalamus. It sits in the indent in the sphenoid bone called the sella turnica. The pituitary gland is one of the 8 interrelated major endocrine glands. It is a queen gland. A pineal gland, conarium or epiphysis cerebri is a small endocrine gland in the brain of most vertebrates. The pineal gland produces melatonin, a serotonin-derived hormone which modulates sleep patterns in both circadian and seasonal cycles. The shape of the gland resembles a pine cone, which gives its name. One time we are in an awakened position. And sometimes our quarter or half time, we were go to in a sleeping condition. So this is our anterior pituitary and posterior pituitary glands. Very small gland. It produces, I don't know how much hormones. We know a few about it. Very few about it. But there are numerous hormones it produces. A minute hormone, minute quantity of hormone can change your everything. It can change. Today we can think about circadian rhythm. Why many times I always try to say something about circadian rhythm. Because our homeopathic medicines says what is the aggravation time of arsenic alb? Midday, midnight aggravation, isn't it? What is the aggravation time of lycopodium? 4 to 9 p.m. Some medicines are acting in the morning time. There is a saying that Nexomica should be given at night. And another medicine, basilinum, give at night. If a person having severe asthmatic condition, we can use basilinum, very minute quantity. It may give good sleep and immediate relief. But it should be, it should not be in a big quantity. A small doses must be very small dose. A circadian rhythm or a circadian cycle is a natural internal process that regulates the sleep-wake cycle, repeats roughly every 24 hours. These 24 hours rhythms are driven by a circadian clock, and they have been widely observed in animals, plants, fungi, and cyanobacteria. Changes. The cycle. Our hormones are produced. These hormones we should learn, attach with our homeopathic medicines. These are the conditions. (12 noon). Best coordination, 2:30. Fastest reaction time, 3:30. Greatest cardiovascular efficiency and muscle strength. Other times the muscles will not be that much strong. Greatest cardiovascular efficiency and muscle strength at 17, that is 5 o'clock. Highest blood pressure is 6:30 or 18:30. Highest blood pressure in our body. Highest body temperature, 7 o'clock. That time, the temperature will be high. Melatonin secretion starts, one of the hormone which is very much needed for sleep. What time? 9 o'clock. 20:30, bowel movements suppressed. That time, we should give what medicine? Nexomica. Bowel movement suppressed. So that is why they are saying that we have to take food before that time. Because the bowel movements are suppressed. In that time, if we are taking medicine, food at 11 o'clock, that is in the slowest position. That time, our bowels are not properly, that is going to sleep condition. So that time, we are taking medicine, we are taking food. I normally taking at 11:30 night. We can advise others, but we cannot. We cannot do. Bowel movements are suppressed at 10:30. At midnight, that time we have to give, if there is any aggravation of complaints. Why? Arsenic we give that time, midnight. If there is midnight aggravation of dyspnea, taking breath, that time, because all the metabolism is in a slow, very slow, and in a suppressed time. That time, normally the lungs will also will not act. in its full strength. That is the sleeping time, midnight. Deepest sleep at 2 o'clock. Deep sleep. Who likes that deep, this time? Robbers like this time. They know that at 2 o'clock, they will be in a deep sleep. So we can go and rob them. They are planning to rob at the time of our deepest sleep. Lowest body temperature. I told that highest body temperature at 7 o'clock and lowest at 4:30. One of Chief Minister of Andhra, he starts his life by he was N.T. Ramarao, that great personality. He usually takes 3 hours exercise daily. He was a film actor, and he became the Chief Minister of Andhra Pradesh. And his office opens at 4 o'clock in the morning. Somebody asked him, this is 4 o'clock in the morning, your office is. So he told him that last 40 years, I am practicing this. At 4 o'clock, his office will start. Indira Gandhi, our ex-Prime Minister of India, only 2-3 hours she takes rest. Napoleon Bonaparte, the greatest emperor, he takes only 1 hour rest. Whether it is in the war front or in his home, he take only 1 hour rest. Is it needed for 1 hour? He was a brave, he was a genius, he was an intelligent person. He told that sleep is one of the things that makes one lousy. Now, the sharpest rise in blood pressure is 6:45 in the morning. Blood pressure. And here we can see that at 18:30. That is 6:30 in the evening, and blood pressure rises in the 6:45 morning. And that time, after that, the melatonin secretions stops and we awake from dread. But those who are rise from bed in 3 to 6 and doing work, that is, our ancient sages says that it is in the Brahma Muhurta. Whoever starts living in the time of 3 a.m., they will attain anything, whatever they think. That is a God's time. The bowel movements are starting at 8:30 and highest testosterone secretion at 9 o'clock in the morning. That time, that is why our work starts from 8:30 to, or from 9 to, that time our alertness, highest alertness at 10 o'clock to that time, the remaining time. So in the morning time, we can do everything. This is our natural clock. Our body is like this. A person who is in his natural life, this is the clock of body. But we are changing our clock. That is one of the main reasons for our diseases. This clock in a different shape. Some are the glands more acting. What time? Hippocampus neurogenesis. Arterial pressure. That is what I said. These are the sum of our body acting. The glands. Heart is acting. Neurological alertness. We already saw that. Nervous energy production and our neurological system are acting. And after that, from the head to the lower part of the body, it is going. You can see it. From head, acting. We have plans, many plans. We are going for something to do. We are in a hurried position to go. We send our children to schools and we are going for job and everything. That time, arterial pressure and heart is more acting, and arterial pressure, hypertension, cardiopathy, increased risk of injury and myocardial infarction. These are the time heart having the in causing the changes in the heart condition. Tumor genesis. After that, liver starts action, altered because we are taking food and everything. Our liver will try to act. This is the big organ in our body, and it is store production, energy production, and it may send. It is at the same time, liver is an endocrine gland and an exocrine gland. What is the difference between exocrine and endocrine glands? Ductless glands and duct gland. From liver, there are ducts. Some tubes are flowing through it to the stomach. Hormones, enzymes, bile, and everything. At the same time, it's produced some of the hormones. It may directly goes from liver to enzymes and hormones, lipid, and we know that the digestive processes are happening in the liver at that time. And that after that, we have consumed food and everything, sleep starts. And this time, catabolism, anabolism, you know that metabolism having two stages. One is the one time the repair mechanisms are starting while we are in a sleep condition. That time, these are the hormones are more active. And we can see that testes, altered hormones, secretion of ladies, testes, and these are the hormones are more produced. And pancreas producing insulin and other hormones, which are helping to take whatever they send the hormones, and we can see here, we can see that on another thing we have to notice that here, the metabolism, we know that whenever we ingest a food, it may go from stomach to duodenum and in 3 hours. But it may travel throughout our body, and the 18th hour, the end stage of the food may disintegrate it into small particles, and it may absorb in the bloodstream, and wherever it is needed that time, it may reach there. That time we can see that the same carbohydrate may become glucose, fat, and everything. So the total mechanism of metabolism is happening in all these 18 hours. These are the hormonal changes, peak time of functions. Midnight to, these are the hormones, WBC formation. While we are sleeping, that time WBC formation is more. If sleep is reduced, means that his immunity will be low. If we are not giving much time for sleep, that time our WBC count will be reduced and there is chances of immunity, weak immunity. Now TSH, thyroid hormone, that is also in the sleep time. Thyroid hormone, TSH. Why we are taking TSH while thyroid stimulating hormone that is produced in hypophysis? Why we are not looking for a TSH? TSH level, whenever we are learning, whenever we are considering a patient of TSH level, we are always noting. Why? If the hormones in the thyroid gland is not producing properly, T3 and T4, it is stimulated by the TSH. When the TSH is high, what we should understand? TSH is high. That time, we should understand that the production of T3 and T4 is not normal. So, more and more TSH will produce to stimulate the thyroid gland. Then, other thing, lymphocytes, atrial natriuretic peptide, this it produced in the heart. ACTH, FSH, LH hormone, cortisol. Cortisol is produced in the testosterone, plasma, or renin activity, all cortisol. Cortisol, what is the importance of cortisol? It is making our emotions more produced in the angry persons. That time, why in menses during premenstrual syndrome, cortisol production will be more. Testosterone production. And these are, we know that platelet addition, viscosity, blood viscosity. And whenever there is a, in Japanese, they are taking water therapy. They are using water therapy. They are taking 1 liter of water or 1 or more than 1 liter of water in the morning. Why? Because if we have 6 liters of blood, if we are taking 1 liter of water, means what will be the change in our body? The quantity of blood will increase. How much? It may go to from 6 liters to 7 liters. Sometimes, if we are taking 1.5 liter of water, then the blood quantity will be 6 to 7.5 liters. It may easily go to the kidney. It may travel kidney because in 5 minutes it may go 1 time. The whole blood will pass through 1 time through kidney. If the blood density is reduced, if the viscosity of the diluted. It will be, if it is diluted more, that time the blood will travel all part of the body without any restriction. That is why they are taking that the eliminated, the impurities in the body will be eliminated through kidneys. That is why they are advising that we have to take 1.5 liters of water in the morning. It is in the halfway of our metabolism time. So it is a good thing for intake of blood at that time. The hormones will be also, this we can see that the hormones and cholesterols and everything will have space in that time, and it may travel throughout the body. Now, this we saw. There is some doubts. Is hypophysis and pituitary gland the same? Sometimes we may be confused. I have many times I have confused. Pituitary gland is also called hypophysis. Ductless glands of the endocrine system that secretes hormones directly into the bloodstream. The term hypophysis from the Greek for lying under, another name for the pituitary, refer to the glands positioned on the underside of the brain. So, hypophysis and pituitary gland are same. It is a Greek name. This is another pituitary gland. Whenever there is sudden blindness, we can see that in getting a hit on the head, immediate loss of sight. What may be the reason? That time, the pituitary gland may shake the optic chiasma that it is near to the pituitary gland, may slightly pressure, and it may cause sudden blindness. If there is any increased size of pituitary gland, also produce sudden blindness or blindness for some time. You know that? All of you know that? Functions of pituitary gland, we are always learning. And let us go to what does pituitary gland controls? Your pituitary gland is an important peach-sized organ. If your pituitary gland doesn't function properly, it affects vital parts like brain, skin. What is its action on skin? Energy, mood, reproductive organs, vision, growth, and more. It is a master gland because it tells other glands to release hormones. It may instruct others, you do this, you do this, you do this. The pituitary gland commands them. You have to do everything. Otherwise, the other systems will be not properly active. So, we should keep our pituitary gland normal. So, whenever we take a case and whenever we study materia medica, that time we should give these parts, every gland we should give. Which, whenever we study a medicine, anatomy, while we are reading the organon 39 and that aphorisms, that time, Hahnemann says that similar diseases can cure. That is homeopathy. Similar medicines, similar disease can cure similar diseases in our body. If we have a small chicken pox, it may cured by cowpox. It is natural cure. Small skin diseases will be cured by big skin diseases. If one come, the other will go. That is similar to what he saw. He illustrating this. Many doctors having says that whenever a big diseases, the similar disease, if it is a natural disease, it can also expel the small similar disease. This principle is studying. They studied well and says that artificial also similar disease can cure. That is what in the vital force theory and the number 26 of our aphorism says that a weaker dynamic affection will be extinguished by a stronger medicine. Homeopathic medicines, if stronger, it can cure the similar diseases in our body. So that is our faith. Some doctors go, or every doctor should go to the similimum. Similar medicine we will get. Similimum will get. That is our aim. Some doctors are doing similimum. Some doctors are doing with medicine similimum. How? That is another. Studies should be done in that way. More than one medicine is acting. That means they are making, with two medicines, they are making a similimum. That is also possible. That is also possible. Why? If Hahnemann says that one medicine after one medicine, if it is not, it ceases its action, then we have to take another medicine. There is another principle is also that two similar diseases of natural diseases, even in the two similar diseases of a bigger dynamic affection will also extinguish a single disease. That is another principle we have to think. I just put forward into you. That is odds discernment of doctor's discernment. Stimulates, pituitary gland stimulates amuscular activity and overcomes uterine inertia. It has influence over unstriped medical muscular fiber is marked and help. These are the medicines. Today we can go through these are the medicines which is more useful in hormonal disorders and in very much useful in pituitary gland affections and brain. Beta force 3x, beta carp 3x, Silucia 3x, Puja 3x, Calcarea force 3x, Natamur 3x. Some are our tissue remedies. Others are some medicine. I told a case. If I heard from Dr. Rajendran, who was a nanoscientist, came to our platform and told that I gave one medicine, Medorinum, to a person, and he was very stingy and miser. After he was he's not a good man. He's a highly educated man, but he's not a good man. That time, he gave medicine for some other conditions. He was a drunkard and he gave that Medorinum. And after consuming that medicine, he became a good man and his stinginess all gone. He laughed and said this thing, but I practiced this. I gave a person, a girl, a lady. She is always calculating everything, each and every penny. She is very stingy. That time, her daughter told me that, oh, we cannot tolerate her. He's a rich lady. I gave her Medorinum, 10 or 1 or 10. I am not remembering. A few days back, she came to me, my father is now very liberal. She is giving money. She is taking, she's saying, no, you take money, take money, take money. She's giving. So you person, you also you should practice this. I'm telling you that you give better enough for those who are stingy. So these are the things I can say today, but I am very much thankful to you all hearing. So now this is the time for our discussion part.
Yes.
Don't ask intelligent questions and many things. Only simple questions you can say, you can ask.
Okay.
If possible, I can say. Thank you very much, Doctor.
We must thank
Doctor.
Dr. Hubert for preparing this program for today's because of an emergency situation. This ever-ready man fellow is Dr. Hubert Silva. So time for discussion. Those who would like to participate, please raise your hand. It's a wonderful session and discussed about this, the circadian rhythm and the application of homeopathic medicines. Very, very interesting. And I think a lot of discussions and reflections are needed in these aspects. Then again, you told about this Horizon 26. But what is more interesting and important is that similar in manifestation but different in kind. That is the option, that's the possibility homeopathy opens. Even though the medicines, the COVID comes, or new or some certain chemicals, this person is affected. There again, we can use our traditional medicines because of this clause. Similar, the manifestation is the main point, not the medicine. While different in kind. But unfortunately, the organon teachers, they just go through, rushing through these topics. They're not bothered about that. Neither to the student nor the teachers. That's all happens. Yes, this our Ram Pravesh Shah sir is there. His louder voice. Yes, sir, please. You can unmute now. Yeah.
Thank you, everyone. Congratulations, Dr. HUBERT De Silva, emergency chief guest. Hindi emergency chief guest, Dr. Venkesh Sahni, and English emergency chief guest Dr. HUBERT De Silva. Very thanks. Very nice presentation, excellent session, natural clock of body. This very nice endocrine glands, exocrine glands, just like real class of physiology. Yeah, very nice presentation. Thank you, thank you.
Okay, yes.
Thank you, sir.
Then you said about this, the rise of temperature, then the blood pressure at a specific time. But we can't exactly say why this aggravation time is 12 noon or this early morning aggravation in certain persons, certain constitutions. Then again, you said about this transforming persons into healthy mentality. That's another important thing. This, as the Gita says, Mugam karodi vajalam pangum langedegirim. You can make the person who cannot talk, when you talk with you. That who can't walk can be a normal person. By the mental transformation is possible through homeopathic medicines. That's the most important thing. If anybody would like to participate, to add something, or you can ask some questions to Dr. Hubert Silva. He is bold to say everything because he knows that how to say yes, how to say no. I don't know. That's the most important, the most simple thing. there is no inhibition is needed. That is the most. He always smiling. That's another about positive things. Dr. Neha, what is your opinion? Yes, please unmute. You can unmute now. Yes.
Okay. Yes, sir. I'm audible, sir.
Yes, of course.
Yeah. Yeah, Dr. HUBERT De Silva, it was a very informative presentation, sir. You told us new things about how, according to the sleep and wake cycles, different hormones are acting in the body. And I hope we can use this information by selecting medicines according to these cycles. Whenever there is which hormone is getting, is having a spurt or it is getting decreased. So according to this, we have many medicines which can act directly upon these hormones, and also constitutional medicines can be used to alter these concentrations according to the circadian rhythm. It was a different kind of insight into hormones. So it was a very nice topic, sir. Very a pleasure to hear you. Thank you, sir.
Thank you, doctor.
Yes, another thing Dr. Hubert mentioned about the difference between words and deeds. In Tamil, it says, "Ettilappadi, paitilippadi," just like difference. He said, we advise all patients to keep all this diet and regimen, so this way, that way, we practice another way.
Yeah.
He just mentioned about the ideal time to take the supper and what is happening in his life. He is also very open-minded person, that indicates. Then about the textbook, the physiology textbook, unfortunately, in these recent days, nobody is reading the basic textbooks. I think the guidance physiology is the most important textbook. What is your opinion, Dr. Hubert?
I don't know about it, but I used to that time. It was in the my college time. I read it. Chatterjee. I think that his name is Chatterjee. The 2 volumes are there.
Yes.
I read fully. I read that book without knowing everything at my 17 years. So throughout, I read the 2 books completely.
But I think you must read this guidance textbook of physiology. That's a wonderful text. And definitely that will give more inputs to your knowledge, because you are still studying and learning a lot of things. Yes. If anybody would like to participate. Then another thing is that when you study the medicines in this according to circadian rhythm, definitely that's a great tool to study materia medica. Now, Hubert, what's your opinion?
Pardon? I just want to. Okay, tell me. No,
Yes, it's
please.
a great tool to study materia medica.
Yeah.
You can mark medicines according to different times and time modality and the circadian rhythm. You can blend it. Yes.
There are even the each and every word used in the materia medica is very serious. Next time I go to that enmity, there are so many words, terminologies are using in the materia medica, and each and every having its own degree of thing. If the anger, angry, enmity, there are so many words are using there. Quarrelsome, each and every word having its own level of stage. So whenever that is, I think that these are all from taking, these words are in from Bible. Whenever we read Bible, that time we can see that these are the words using in Bible. I read Materia Medica before that. I read Bible. After coming to Bible only, I can understand the meaning difference between what is used in the Materia Medica.
Yes. Okay. That's the important thing. Then, of course, the languages, the English is often derived, a lot of using there, a lot from Greek, Latin. They are not reluctant to take words from other languages. That may be a reason. Then again, Hahnemann is a philosopher. The Hindi topic they mentioned about the Sora, the ancients derived from around 3,000 years history. It was mentioned there. The Leviticus is there. The 5 books are there in the Bible. That is mentioned in this footnote of this chronic diseases. That's also very important. And the derivation of the Sora, then the leprosy is there. It was mentioned there. All these things are there. So Hahnemann traveled back to 300 years, 3,000 years.
Yeah.
Then he's developed this theory. The most ancient, the most universal, the most destructive, yet most misapplied chronic miasmatic disease. That's a word he used. We cannot add anything more to that. We cannot delete a sentence from there. The most ancient, the most universal, the most destructive, yet most misapprehended. Then again, if you study the homeopathic material properly, at least it is only a Shakespeare can perceive the meaning or interpretation of the actual symptoms. The lycopodium symptoms, a lot of mental symptom conditions are there. We can't interpret it because it requires a IQ more than 140 or 150, I think, around 140. But unfortunately, we are around below 100. That is a lone problem homeopathy faces. Then again, from the common man who really recognize homeopathy other than homeopathist, Einstein, Rabindranath Tagore, then of course Dr. Radhakrishnan. They are intellectual persons. They can follow it. So the critics, the superficial critics, they can't follow it. That is the most important thing, I think. And I think now we can go to the concluding session. If anybody would like to participate or add something, it's time. Hubert De Silva, doctor started with the brain, some infarction is there in the brain. Then definitely with our medicines, we can dissolve it without causing adverse results. The other medicines, other branch of medicines really struggling to dissolve all this clot. Then they give some medicine, definitely that will produce some another great tragedies. So without doing all these things, any untoward reactions to patient causing untoward reactions, a simple safe medicine is homeopathy. That is why Hahnemann described it as the greatest gift of God. Homeopathy is the gift of God. That's why. It's time for concluding. I think we must include Dr. Neha to express vote of thanks to our Dr. Hubert De Silva, the composer, musician, the all-rounder Hubert De Silva. Yes, please.
Yeah, it was another wonderful session from IFPH where Dr. Hubert De Silva presented informative and very good session on endocrine disorders and how we can match our homeopathic constitutional remedy giving along in many endocrine diseases. And in future, we hope to get much more information and knowledge from him. So thank you, Dr. Hubert De Silva, and I thank Dr. Manoj also for sharing his wonderful views on the topic. Yeah, thank you everyone for joining.
Yes, this journey is for the last 1,265 days. That means around 4 years.
Yeah, that's
this is the greatest gift of God, I think.
yes, yes,
Yeah.
yes.
Nobody knows
Also,
how this continuing. It is a great
Yes.
wonders.
Yeah, it's a
Even
very,
beyond-
very pious work everybody here is doing and
Yeah.
presenting their thoughts and knowledge and sharing
With-
the knowledge and wisdom on the
With
topic.
limited resources, that's the most important thing. Our Thanesh doctor, we must salute him, no doubt about that. He's working very hard. He's a very busy practitioner. Not only busy in his practice, but his domestic affairs. He's very busy. He's not now there in his home. He's traveling.
Yes,
Still,
yes.
he manages with Hubert De Silva this edition. I invited me to this moderate session. Very, very wonderful. We must salute Dr. Thanesh also. The homeopathy fraternity is indebted to Dr. Thanesh. With that remark, let me conclude today's English edition. Hope you to meet the same day tomorrow. Till then, goodbye. And Dr. Mariama John to continue the program in Malayalam.
Thank you, everyone.
നന്ദി മനോജ് ഡോക്ടർ.